Hello, and thank you for tuning into this video where I'm going to be talking to you about chest pain or chest discomfort. My name is Andre Huey and I'm a physician assistant. I work in the emergency room taking care of patients, and chest pain is a complaint that we see a lot of. And before I go any further, I want to stress to you, if you're having any kind of chest discomfort, pain, discomfort, any kind of worrisome symptoms in your chest, don't wait for this video. Don't use this video to choose or determine whether or not you need to go seek help. You need to stop right now and go to the emergency room to let them evaluate you further. It's very important that you have that investigated. So I'm going to talk to you now about chest pain or chest discomfort. I'm going to describe to you, if you come to me in the emergency room as a patient with those symptoms, what are some of the questions I'm going to ask you? Maybe what are some of the type of testing that I'm going to do? And then I'm going to get to what are some of the conditions or the situations that could be causing you to have a discomfort or a pain in your chest. I'm not going to go deep into therapies or treatments of your chest pain. I may allude or briefly hit on something here and there, but for the most part, it's very important for that to be determined by the medical provider that you're seeing at the time, and that be based on what they have found as they have investigated the reason or the cause of your discomfort. To start off, let's pretend like you're coming to see me in the emergency room and you have chest pain. When you first come in, you get checked in, you're on the heart monitor, you're in the treatment room, and I'm asking you questions. So I'm going to ask you, what type of pain are you having? And you're going to describe it to me. And you could be having chest pain that is described as a burning sensation, or a pressure in your chest, a heaviness, a fullness. It may be a tearing sensation, sharp shooting. Whatever it feels like to you is how you're going to describe it to me. And I may ask you where on your chest it's located. Is it right in the center? Is it up high? Is it on the right or the left? I'm going to ask you, does the pain move around any at all? Does it stay in one place in your chest, or does it go up to your neck or your jaw? Does it make your teeth hurt? Does it go to your ear? Does it go to your shoulder? Does it go down your arm? How about, does it radiate straight through to your back? Those are going to be questions that I ask you, and that all is going to play into my line of thinking as to what is causing your symptoms. I may ask you, or I will ask you, did the pain start abruptly, or was it a gradual onset? Is it constant? Does it come and go? Do you have shortness of breath with it? Nausea or vomiting? Did you break out in a pouring sweat with the pain? I'm going to ask you, is there anything that you do that makes your pain better or worse? Is it worsened with movement, or with taking a deep breath, or coughing? Did you take any over-the-counter medicine for it? If you're a heart patient, did you take any nitroglycerin for it? Have you taken any aspirin for that? If you have taken anything, has it made it better, or has it made it worse? Is your pain worse with eating or swallowing liquids or solids? I'm also going to be curious and ask you, have you had these type of symptoms before? And if so, was it ever investigated by a medical provider? Did you ever find out what the cause of it was? How many times have you had it? Did you ever take anything for it at that point that helped you or made it worse? And I'm going to ask you about your family history. Has your mom, your dad, brothers or sisters ever had a heart attack? And especially, have they had anything like that at an early age? Then I'm going to ask you about your medical history. Have you ever had a heart attack? Are you a diabetic? Do you have high blood pressure? Do you smoke? Have you ever had a cardiac catheterization or an echocardiogram or a stress test? All of those questions help me in my evaluation of your discomfort start putting different thoughts and processes in mind as to what your symptoms can be. At the same time, I will have looked at your electrocardiogram that the nurses did when you first arrived in the emergency room, and then I'm going to order some blood tests to look at your electrolytes, your white blood cell count, your liver enzymes. I'm also going to look at your heart enzymes, something called troponins. I'm going to get a chest x-ray. So to discuss some things that now could possibly be causing your symptoms. The first one, and the one that everybody thinks of, is, are you having a heart attack? And again, that's evaluated by your history, your physical examination, looking at the heart tracing or the electrocardiogram, and then looking at your heart enzymes. And more than likely, you'll get more than one, depending on the situation. Just your EKG in some situations, if you're having a definite heart attack, will be enough. But a lot of times it's the EKG, it's the physical exam, it's the blood work, which includes heart enzymes, for your medical provider to ultimately determine what's going on to cause your symptoms. The next thing that could be causing you to have chest pain is called a pulmonary embolism, which is a blood clot in your lung. And a lot of times that can be found on a special CT scan of your chest and lungs called a CT pulmonary angiogram, or a CTPA. Sometimes people will have an aneurysm in their chest called a thoracic aneurysm. There's an aorta, which is a large artery that comes off of your heart. It goes down through your chest and into your abdomen, and it has other arteries that come off from it that supply other areas of your body. This is a big vessel, and it can sometimes have swelling in it called an aneurysm. It can happen in your chest, or it can happen in your abdomen. Once that aneurysm, that swelling, gets big enough, it can start causing pain. It can start leaking or tearing, which is called a dissection, which causes significant discomfort. It can also rupture. All of that is a very severe, life-threatening issue that your medical provider will have to find, diagnose, and then get you the appropriate help. The next thing is that you could have pericarditis, which is an inflammation of the pericardium or the sac surrounding your heart. And there are many causes for pericarditis, and we'll defer that to your medical provider to describe should something like that turn up on your exam. But pericarditis, inflammation, that can also cause your chest pain. You could also have fluid around your heart between the sac and the actual heart itself, called a pericardial effusion, which can cause chest pain. You can have an infection in your lung called pneumonia. That can also cause chest pain. Most times it's associated with a fever or cough or congestion or shortness of breath, but on occasion you will just have the manifestation of pneumonia as chest pain. And that is most of the time seen on a simple chest x-ray done at your doctor's office or in the emergency room. It'll show a pneumonia. Sometimes it might take a CT scan of your chest to find it, but most of the time it's on chest x-ray, and that treatment will be determined by your provider who's seeing you at the time of that diagnosis. Your lung collapsing or a pneumothorax, that can cause chest pain. That can come from trauma. Either coughing can cause that, or a car accident, or a fall, or a stab wound, or a gunshot wound. And in some cases, in some people, in certain situations, it can happen spontaneously. And again, that's called a pneumothorax, or the lung collapses. And the treatment of that is usually hospitalization and a chest tube. But again, a lot of that's determined on how severe your symptoms are as to what exactly the extent of treatment is required. You can have pleurisy, which is an inflammation of the lining of your lungs. That can also cause chest pain. Then the next thing is something called a pleural effusion, which is fluid around your lungs. Can be irritating and can cause chest pain as well. Your chest pain could be coming simply from a pulled muscle called musculoskeletal pain. That can come from lifting, from turning, twisting, coughing. It could come from an injury such as a car accident, pulled muscle from that, or even a contusion. Acid reflux or GERD is another cause of chest pain as well, and a lot of times it can be associated with eating and drinking. If you have pain on one side of your chest and it's associated with a red raised rash, that could be a shingles rash or zoster rash, and that comes from the herpes virus. That ultimately came from you having chickenpox several years back. Once that rash from chickenpox went away, the virus, the herpes virus that causes that, goes dormant. It goes to sleep. It doesn't go away. It goes to sleep in your skin, and then possibly down the road in the future, you could have that rash, that herpes virus wake up, and it manifests itself anywhere in your body, but it's usually just one-sided. It doesn't cross the midline, and it can happen one side of your chest, one side of your abdomen, one side of your face, but it's going to be just in that one area. And if it happens to be on one side of your chest or the other, it could cause chest pain. So that could be another cause. Another thing that can be causing you to have chest pain is actually your gallbladder. You could have gallbladder stones or a low functioning gallbladder, or even an infected or inflamed gallbladder that can be causing you to have pain up into your chest. It could actually go up into your shoulder, into your back as well. So that's another cause. And then the last thing is that you could have inflammation in your pancreas called pancreatitis that can actually be radiating up and causing you to have some chest discomfort as well. Pancreatitis or the pancreas lays in your upper abdomen just behind your stomach, and again that can cause you to have some chest discomfort also. So that's the list I have of things that can be causing you to have chest pain or chest discomfort. It may not be all inclusive, but the most important thing again that I drive home to you is that this is just an informational video. If you're having concerns or questions about symptoms you're having in your chest, don't use this video to make that determination of whether or not to seek help. Go see your doctor or the emergency room right away to let them evaluate the symptoms that you're having to help you determine what that is. So thank you for watching this video. Please subscribe to my channel, like and share this video, as the information is really important and anyone can benefit from it. If you'll leave a comment as well, I would truly appreciate and like to hear from you. And check out other videos, the links above here, on other topics that I have talked about on this channel as it relates to the emergency room, the processes, and other conditions that may cause you to go there. Thanks a lot. Take care.